Hi, my name is Dr. Balta, and you're about to get cervical decompression. And I'm here to explain to you how the cervical decompression works and how we're going to set you up on it. Okay? I'd like to explain to you why you're getting cervical decompression, why the doctor, myself, or another doctor prescribed cervical decompression for you. So, most likely, you have either a thinning disc, which we call disc degenerative disease, or you have a disc herniation or a disc protrusion in that area. Okay? So, either way, decompression is going to be the best treatment for you, whether you have disc degenerative disease or a disc herniation. And the way it's going to work is it's going to go ahead and pull on the spine to open up the space in that area. And by doing that and creating this vacuum phenomena, it's going to suck up the material back in. Okay, so if you have a disc herniation, it's going to suck that little material back in there and then help the disc rehydrate again. Now, how we're going to set you up is you're going to be laying down. I'm going to use this model right here. Is you're going to lay down on your back with your head up here and looking up. And what's going to happen is the machine is going to pull and release, and that's going to create a negative pressure in that disc, open up the disc space, and by creating that negative pressure, it's going to suck that material back in. It's like holding a sponge in your hand, putting it in a bucket of water and letting go of it. That when you let go of it, all that water is going to get into that sponge. That's what we're trying to do when we do spinal decompression. Another reason for you to getting spinal decompression, if you tried chiropractic care and hasn't been working, this will be a good adjunctive to it, and then we get you back on chiropractic care. All right, so what I'm gonna do right now is I'm gonna set up a patient on cervical spinal decompression machine so you know what to expect. With everything that we do, your comfort and your safety is our number one priority. So make sure you're always communicating with us that you're comfortable, and also making sure that you're okay while you're on the machine the whole time. Okay, so it should not be painful at all. All right, so I'm gonna go ahead and bring the patient here. I'm gonna go ahead and have you lay down on your back, please, and then we'll get the footrest for you. Come on up a little bit more. Come on up more and more. Okay, you comfortable? Okay, lift up this legs. There you go. Good. And then what we're gonna do is tighten this up. And again, what we're trying to do is get that mastoids, which is the little bumps that you feel here behind your ear, locked in. So when the machine pulls, it pulls on that, and then get the neck decompression going. Okay. We're also gonna put this down right here on the forehead, and that's to lock the head in place. So when we get a nice pull, the head doesn't go forward, and we get the spinal decompression that we're looking for. Okay, the machine is already connected, and usually what's going to happen is when we start, it's going to pull and release, pull and release. It's really comfortable. There should be no pain throughout the whole process. You're actually going to feel relief while you're doing it, and most patients either fall asleep or just relax the whole time because they say that's the only relief time that they feel throughout the day. Now, your safety, like I said, is our number one concern. So you're in charge of the machine. We're going to give you this button right here, which we have you hold it. And if you press that red button, go ahead and press it. It's going to stop the machine, letting us know that you need help or like you need something, whether you need to go to the restroom or you feel like the weight is not, strong enough or it's too much, then we could, come in and make the proper arrangements for it. Okay, so you're always in control of the machine. You can stop it anytime for any reason.